Hello, my name is Dr. Mikel Hoff. I am the inventor and founder of Amino BioFrequency therapy. In my 25 years as a therapist and specialist in nerve system, I always dreamed of to find a therapy that can increase signalation in the nerve system and repair it, so we can give a therapy that is self-healing without medications or other instruments or machines. With this therapy, the normalization of chronic pain or inflammation or sports injuries is beyond what I ever expected to get out of it. I hope you will join us and see what it can do during our educations or wherever it is around the world. Thank you very much.
Intelligent and before his time, he said the doctor of the future will not prescribe drugs. Instead, he will awaken the interest of the patient towards his body, as well as to the reason and the possibility of preventing disease. So this is what we do. The reason I chose that this therapy should go to people that work clinically with patients is because we need this tool, and that's why I don't want it to be in hospitals or in pharmacies. A little bit about myself. I have several PhDs, but also a medical sports injury specialist, manual therapy, sports performance psychologist, and of course pain specialist and founder and inventor of Amino BioFrequency therapy. So my specialty is in the nerve system function, and also how the body's priority system and resources and the biochemistry reaction in the body is working. Also the lymphatic function and priorities, and of course, as I said before, the biochemical function and the body's function when it comes to mutating the cells and releasing the resources that heals the body up as it do. The body is a very, very amazing tool, and the more you understand about it, the more amazing it is. And I'm quite sure, as I also say on educations, that here in 1.5 years, you learn everything about normal medicine, the biochemistry of the body, and nerve and lymphatic system. So it's quite complicated, but in the end, everything falls into pieces. But again, never forget to use all other things you have in your backpack that make you the therapist or the doctor you are today. So why is it so revolutionary? Yes, for decades, researchers have known that poor damage nerve frequencies increase inflammation and impaired functions of the nerve system, and ultimately the body shuts down. So it's also well known that all autoimmune disease, no matter what we get, everything starts with inflammations. And until today, it's had not been a possibility to solve this problem. How can we control and refocus the body's resources through the nerve system that is our communication system? And during all this research they have done the recent decades, is that what's come out of it is laser therapy, that is today the only known one that actually can repair and support self-healing. But the problem with laser therapy, as soon as you remove the laser pen from the skin, that signalation is of course interrupted and stops. And that makes also the problem that the patient needs to come over and over again. It can take long time also for the therapist to do it. Also, if we talk shock wave and everything, it's also waves and frequencies. Because everything is in the body is frequencies. And this is where so many stand up and say, what frequencies? You never heard about it. But of course, without electricity or impulses or frequency, whatever it's called, the body cannot work. The blood cannot flow, organs cannot work. Everything needs to have some kind of releasing factor. And that's why we also have if you look at the blood, that is, you have one outgoing and you have one ingoing, that actually is one plus and one minus. So why should you use this therapy? Yeah, because it's normalized the body's normal functions and help the patients recover from where all other treatments can't really help. And it covers most of it. As a therapist or a MD or physician, is that you don't have to wait 3 weeks or 2 weeks for see the effect. How good are you as a patient? Does it work or does it not work? Here we're talking 5 to 10 minutes, and both the patient and you as a treater will definitely notice the difference immediately. And as long as the body is controlled by the nerve system, everybody have a reaction of this. So we actually guarantee all patients, no matter what level pain they have, that we guarantee them 50% pain reduction in 5 to 15 minutes if they only drink water, because water is increasing the signalation strength. So we can increase performance, endurance, and muscle movement. And it's the only therapy out there today that can repair a broken or a weak signalation. It increased the body's self-healing ability, strengthens organs and gland functions, and most important, we have no chemical or organic substances, and each patch is active for 72 hours, and this means also that it's very easy for the patient to change them at home once a week until they come on checkup, and I will come back to that as well. This is Dr. John Poorman from Arizona, USA. He's a sports med, and as he says here, as you can read, the past 20 years have always been the forefront of utilizing the most efficient technologies. I want the very best in each for every patient I see. So initially used chiropractic, ultrasound, inferential, then I switched to using laser, a Russian stim, soft tissue techniques, and chiropractic. Now I utilize chiropractic, neurological resetting when I appreciate a nearly 100% of time with immunotherapy patches. And many times I find the patches alone help me achieve the result of decrease the pain and inflammation within minutes. I can say in the past 20 years of practice that not a single therapy or even combination of therapeutic inventions have produced the immediate results I have witnessed on a daily basis. And it has been a lasting effect that others are seeing as well too. Thank you. And you can also, I can say now, if you go to YouTube after this, you can see a lot of testimonials if you search on Amino Academy or on my name. So what is this? For 25 years ago, NASA invented this material, what the patches is produced of, and it's carbonized metal, and it's 28.4 exactly pure metal. But it's only one part in the world where you can find the raw material to produce this material, and it's only one factory that also is, of course, is special licensed with NASA that have the possibility to do it. So why did they invent this material? Yes, it was because they needed a material to be used in outer space to be able to measure the astronauts' health and to see how the body reacts in space compared to the normal frequencies of the body. So also to send and receive pictures. If you imagine how they can send a satellite to Pluto and all of a sudden the satellite can release the camera, take a picture and send it back to Earth. And this is because of all of this is controlled by frequency. So it can be pre-programmed at what distance, the longer far from Earth, the different frequency is it, of course, should this camera be released. So it also used to as program the satellites, of course, how to fly, where to fly, and it released frequencies into the body, and it's also used by jets, especially military jets, for heating protection. So what is the material's main tasks? Yes, the amazing is it can be charged with the frequency, and it can hold the frequency. It can send frequencies, it can receive frequency, and when it applies on the body, it also is used as a reflector, so the frequency never leaves the body. And this is a very important thing. The therapy is medical class 1, CE marked and FDA approved. This means that it's nothing that is entering the body. It's no chemicals, it's no organic substances. We can use it on newborn babies. I do it a lot, especially with colic babies, or if they have ear inflammation, fever, stomach cramps, and you name it. And also because the tape on the backside is 3M 100% antibacterial tape, this makes also that it's no risk to get skin disease. I even use it on people that have very complicated and sore skin or huge eczema or whatever, without any problems at all, because the glue is antibacterial and get activated when it contacts the body, and that's why it sticks. So patient goes to showers and everything is normal, so they don't need to take it on and off and stuff like this. And kids think it looks cool also. So how does it work? Yeah, to explain it in an easy way, it helps the brain to correct the errors by returning a correction signal. So both the brain and the other parts and organs and glands can work normally. And this means the nerve system is sending 5 to 15 million different chemical and electrical signals in our nerve system to check out what is working and what is not working. As soon as we have an inflammation, we get a weaker signalation, especially when it comes over to a bacterial or a chronic inflammation. So when the nerve system for many days tried to correct this and heal this inflammation, and when it has found out after trying that it's not getting better, then the nerve system shut down and tell the brain, this is so chronic, we don't have resources in the body to heal this. So then immediately the body take and refocus the resources to our life supporting organs. And that's why we, for example, can lie brain dead for years, but everything else is working fantastically, because as long as the signalation is intact with the CNS, we can continue forever without the brain. And this is why the nerve system is so much stronger and so much more important than the brain and everything else. But if you look at holistic and the priority system, then of course it can look immediately different, because the brain is also controlling other functions in the body, if you talk alpha, beta, or omega part of the brain. It's immediately activated by the body's infrared heat. Breaching frequencies also weaken the immune system. And of course, we cannot mix the antioxidant with the one we eat and the one that is produced in our cells and our glands. It's totally different structure, it's a totally different molecule, and therefore is the antioxidants, carnosine, glutathione, and melatonin that's produced in our glands and body enormously different and look totally different as a molecule and the one that we eat. It refocuses the nerve system priorities and the body's defense system and resources. And because that we work with the nerve system, the effect is so fast. And you can imagine yourself 15 million different frequencies per second that is sent out in our body is an enormously big amount. And today we work with 90 different patches. So we have for all body's main function, and of course we have a lot for pain and inflammation, because which frequency you use depend on how bad the inflammation and pain is. control the frequencies and make your body work as intended. Yes, aberrant frequencies, as we talked about before, result in dysfunctional organs and disease. And we can also see it a lot with older people have shaking hands, or it can be restless legs and stuff like this. This is typical signs that we have a signalation that is very strong that's coming out. But it's nothing that come back to the CNS and brain and tell what is wrong, what can you do. So that means the nerve system, when it sends out massive outgoing signals, that also make, of course, the shaking. And if the return signalation doesn't work properly, then we also have a big risk that we have too fast coagulation of the blood. It also react on the oxygen in the blood and stuff like this, and this make the inflammations getting worse and worse and worse. All function in the body is, of course, frequencies. Frequencies create the body's ability to self-repair and the production of the antioxidants. Free radicals occurs when the frequencies drop below its normal level, and oxidative stress means also, except for everything else that is, with the reactive spices, oxygen spice and stuff, it means also mutation of cell. Invisible inflammation is the one that cause autoimmune disease. And invisible inflammation, also well known as the silent killer, is the inflammation you don't feel until you get examined. Because the symptoms is very often that you sleep 10 hours, wake up in the morning, and are more exhausted than when you went to bed. You can also have small memory losses during the day, get extremely fatigue, tiredness during the day unexplained. You just can't stay awake. And of course, you can get huge temper changes. And this is signs where they should go to one of us that is educated to examine and do clinical work through the nerve system, because the nerve system will never lie. Because where you feel the pain doesn't mean where it comes from. Because if you just, for example, all pain we have in the body, 84% of it you feel in the lower back, 34% you feel in your knee. So referred pain is one thing, but if you examine through the nerve system, you will always find the right injury at the right time and where the problem is, if it's intestines or whatever it is, also in lymphatic system. And this is what we teach also, how to check everything from intestines, liver, and nerve system and lymphatic system through clinical work. As I was taught 25 years ago, is that everything you should be able to find with your hands. If you can't find it with your hands, it doesn't exist. If you find something strange, send them to an MRI scanning, because it's so much you can't see on an MRI. And it's so very much today that a diagnosis given if it is something to do with chronic inflammations, because it does not exist anything today that can remove inflammation. Because you can't eat anti-inflammatory pills more than 7 days because your stomach is crashing and stuff like this. So we see all of us and all of you today, very scary how they medicate people with pain, everything from epileptic medications to God knows what. And that scares me a lot, actually. So the method we use is, of course, that we decrease pain and inflammation through the nerve system, because if you can stop that, that means also the body have the possibility to heal up and stop the inflammation immediately through pancreas and all these kind of chemical reactions that's happening in the body. We have a wide range of treatment. We can think about everything that has to do with the problem, everything from organs to inflammation to blood circulation to all of it. We can treat inflammation that is spread through the nerve system, through the lymphatic system, muscles and organs. We can stop the free radicals from spreading if we find a place where the problem is the biggest. Then we go deeper with stronger and higher frequencies, because it's also very different where the inflammation is. If it's in the top tissue, middle tissue, if it's in skeletal cells, how long has it been there, and how high need I do to go in the frequencies to be able to hit that area. Because a lot of doctors think that, okay, if I take the strongest one, then everything is good. No, it's not the way it's worked, because you need to go step by step. Because if you take the strongest one, yes, you can take the inflammation that is in deep tissue or skeletal cells, but what are the one in the top tissue? We can increase the immune system, and I say that a lot also when I patch both my own children and also patients, of course, if they have flu or a cold that is gone in less than 24 hours of flu in 2 days. To use it for rehabilitation, I mean, we can do with this, we can increase the movement in the joint up to 53%. We can remove all pain. And the only thing that actually is stopping the patients from training and doing rehab after surgery is, of course, pain. And that is a problem for all of us, because pain is what stops you. So if you can remove that, that means you can train better, you have a shorter rehabilitation time, and you get better results with the patients. Because many clinics out there that I visit around the world, they have returning patients. They've been a customer, you can call it, in the clinic for 5-10 years, and that's not the meaning with the work we are doing. And we can also, of course, after that, prevent that they get problems later on as well. That is also, of course, very important. But if we do the right training for them, they at least will not come back with the same injury as they came for the first time. Sports. Yes, I have the privilege to work with these guys, but we can do a lot in sports. And we also do, I work with several world champions around the world in all kinds of sports and help them with injuries. We can also remove the production of lactic acid. That means that we have no risk for cramp. We can now treat them for general pain after hard training or after a hard race. Physiological stress, if they have stomach problems, a lot of pros have problem with the different bacteria when they travel around the world, and of course we can prevent that. Cramps, we can reduce pulse reduction, and also mental stress, because a lot of athletes is very nervous and have a lot of problem with mental stress before or also after. It's very hard for them to calm down to be able to sleep. So because sleep for them is extremely important. After I worked with professionals for 25 years, and I know everything but how their life is, and it's not always so funny as people think. We can also improve performance. We can improve concentration. We can improve the muscle performance, muscle building, recovery and regeneration up to 80% faster. Immune system, shorter injury time, sleep relaxed quality after match or race, increase red blood cell production. And this is actually now tested by the people in the Swiss national cross-country team, and the result there from them is amazing. So, and just to tell you, we will release hopefully this year or beginning next year a special program for semi or professional sports. This is a world champion in gymnastics from Croatia, also a Red Bull athlete. As you can see, you can read for yourself what he's saying. He had a huge problem with his shoulders because he was doing all this in the rings as they do in gymnastics. And it was shocking, even if he had an injury at the time when I visited him and he needed help. Just 15 minutes later, he can do the full program in the rings without any pain at all. He said it was like he never had an injury. And that, of course, I was quite happy for. This is another celebrity, Terrari Trent. Some of you know probably Oprah Winfrey. This is her best friend. She had went with a frozen shoulder problem for over 3 years. It's just quite shocking for me. But she's been traveling all over the world to get help from all kind of different therapies and injections and stuff like this. And after one treatment, 45 minutes, we get her on in full movement. And after that, she continue with the patches for 3 weeks or 4 weeks. I don't remember actually 100%. But today she have no problem at all. So she hadn't slept on her left side for 3 years. That's quite amazing. So this is why this therapy is so good, even if people don't believe in it or whatever. As I always say, the more critical you are to it that it works, the better it is. Because if you're not probably not normal, because it looks so simple, this patch, but it is an extremely advanced medical device. But it looks strange when it comes on the body, of course. So what can we help? Yeah, we can normalize. This is the areas that I've been doing a lot in, and this list is today quite a bit longer, but I have tried to test it out on all kind of different diagnoses. I also get a lot of patients from the hospitals here, where they also say to go to him first. If he cannot do anything, we can see if it's possible with surgery or whatever it is. But I mean, everything that I tried on is having an effect. And I haven't, during these years, no patient that comes back with the same problem again. Maybe they come back with a strained ankle instead of fibromyalgia or something, but nothing of what they had before. And that is quite amazing. So who do we educate? Yeah, to do our education, you of course need to have some kind of experience. But for me, what is very dynamic is that we collect physicians, chiropractors, physios, all kind of therapists under the same roof, and that create a huge dynamics and also very interesting because they are learning from each other. And for me, it's quite amazing to see also how little the knowledge is through the nerve system and the biochemistry of the body compared to function or muscles. But for me, it's like that. If you don't understand that, then it's very difficult to understand the rest. Yes, you can increase strength and do training or whatever, but the reason when it comes to inflammation and stuff, it's a little bit surprising. And some have a very, very big knowledge on it. This is a picture when I educated in Germany. Okay, let's see. Last but not most important, energy cannot be created or destroyed. It can only be changed from one form to another. And this is what the nerve system do. So if the heart works on some frequency, it doesn't work, then it changes to weaker frequency, or the resources is going to another place. So this is a statement from some other therapist, what the mind-blowing 2.5 days physiotherapist from UK. It's very much enjoyed Amino introduction course Friday. I'm amazed at some of the results that it has been able to achieve on sample patient as well as myself. This was amazing. Andy is totally blind and both physio and manual therapist and have a huge clinic and do fantastic work. But it was amazing to see how he worked with his hands. So what do you get in the first manual? Yes, as you can see, of course, the introduction very often is the presentation as I do now, so people know what it's all about and what the therapy is, how you use it. Then we go through different frequencies in the body, everything from organs to different diseases that is well known. Then we go through different type of pain, how they feel, how does the tissue feels like if you have different kind of inflammation, what should you look for, and how development of inflammation comes, the reasons. And then, of course, what kind of patches do we use and how to use it. And we have practical training on each other, but most of all, because almost in all modules, we have around two to maximum 3 hours theoretical training, and then 6 hours practical training, including real patients. And here is very important that if you join education, you can also bring your own patients. So you can see on your own patients that you maybe had done an amazing job, but you didn't come 100% in goal. It didn't get really so much better because you couldn't stop the inflammation. Your knowledge was that if I just could do that, I of course could achieve a better result. So on the educations, all test patients that is we can take in are more than welcome, of course. So day 2. Here we go through the antioxidants of the body. I know out there people talk about glutathione, carnosine, and melatonin and stuff like this. But believe me, the ones you can buy in stores does definitely not work, because this as antioxidants you can't produce chemically. It's produced in cells, it's produced in glands, different molecule, different function, and they need each other to create a chemical reaction in the body to actually create the immune system, even if they have a single function, each one of them for themselves. But to do that we get strong and healthy, they need each other. And as soon as if there is any kind of interruption in that, we have a disorder in the body. That's also explained in this education. We go through different kinds of stress. Stress is different kind of energy losses in cells, should I probably prefer. What is free radicals, what is oxidative stress, what is hydroxyl radicals, what is lipid oxidation, and so on. The difference between acute and chronic inflammation. Reviewing the AGL and ACA patches, that's glutathione and carnosine, and also relevant diagnostic. Then again, practical training on each other. Strained neck, shoulder pain, tennis elbow, golf elbow, and test patients, of course. So you can practical, clinical examine it of the nerve system and also apply the patches, see the result, and of course we have a discussion about it. Day 3, yes, recap of part 1 and 2. Reviewing the relevant diagnosis, again, practical training. Then we go through carpal tunnel syndrome, thoracic spine problems, lower back pain. Where could it come from? Remember, 84% of all body pain. But when we examine the nerve system, you will not be a doubt. Again, test patients of diagnosis above, and contraindications. In this therapy, it's so amazing because we don't have any, and we don't have any side effects. Patient ethics and how you can order the passage, and then evaluation and the therapist agreement. Because of medical around the world agreement and contract that you sign, that you follow your country's ethical rules, and etc., as we must do. So this is how the module 1 is working. And I can tell you for sure, after the first 2 days, the first module, all of you will be probably, as everybody say, enormously confused and a lot of questions. It's a lot of new terminology, it's a lot of new knowledge. But after each module, you get more confused, but on a very high level. But in the end, everything falls together, and it makes sense. Because it is much, and I'm quite sure all you ask about it will say the same. I try every time not to go and be too advanced. Sometimes it's very difficult because I love that very much, to actually go to the depth. So I will thank you all for joining this webinar, and we have some few videos. I will see if I can get them up here. Otherwise, you have also on YouTube, if you search on Amino Academy or my name, Mikel H.T. Hoff, you find even more testimonials from patients and doctors.